am super excited because tonight we are going to be talking about a holistic management of PCOS. September is PCOS Awareness Month, so that is polycystic ovarian syndrome. So wear your teal, ladies. Gents, if you're supporting your lady, wear your teal as well. And I am so excited that tonight we have Dr. Sammy with us, and she is going to be giving us her expertise and her insight as far as managing PCOS because a lot of times people are only given the medical based management and they forget about the holistic management. So we're going to talk a little bit about what PCOS is. We're going to go a little bit into the medical management, but we're really going to use Dr. Sammy's expertise to dive into the holistic approach. So that way you all will know different options that are available. So that way you can take control of your health. But before we get rocking and rolling, Dr. Sammy, please tell us a little bit about yourself. And thank you so much for joining and bearing through this with me tonight as we've had all these difficulties. Come off mute for me. There we go. It happens.
It does happen. Hi, everybody. I'm Dr. Sammy. Thank you, Dr. Millbrooks, for introducing me. A little bit about me. I am a proud physician associate for almost 6 years now. I can't believe it's already been 6 years. Outside of that, I am a certified health coach, and primarily I work with women with PCOS, really trying to get them to understand the root cause of the disorder. Because, like you said, there is medication management, and a lot of times we fail to really understand what PCOS is as a whole, and how to get to the root cause of that and address the root issues rather than just the symptom management with which oftentimes we see in medicine. If you or anybody you know has been diagnosed with PCOS, I'm pretty sure that you've heard at the end of your visit lifestyle modifications, exercise, eat right, but what does that actually mean, right? We hear a whole lot of things about PCOS, and oftentimes it is seen as a gynecological issue. And I really want to talk about that because it is more than just a gynecological issue. It is a metabolic condition. Primarily, it has to do with insulin resistance. Not all the time, but I want to say about 80% of the time, it has to do with insulin resistance and our cells not responding correctly. All in all, that causes a whole slew of hormonal issues. And really, when we look at PCOS as a whole, we try to dive into reversing insulin resistance, so making your body more insulin sensitive. And we can do that through lifestyle modifications, changing our diets, exercising, managing stress, our sleep cycles. These have all been beneficial things to help PCOS, as well as supplements, right? Be very careful with supplements because there's a lot of things out on the market, and I'm pretty sure at times it can get confusing. But think of it as like an add-on and very specific to what you have going on symptom wise. Okay, outside of that, I'm a mom, I'm a wife, I'm a Christian, and I'm also a professor. I'm an assistant professor for a PA program where I am actively helping students in their transition throughout PA school, whether that's advising, teaching, all the things. Yeah, that's a little bit about me. Dr. Middlebrooks, would love to hear more about you as well and how your practice incorporates PCOS, because I know you see some PCOS patients as well.
Yes, so my name is Dr. Dion Middlebrooks. I am a physical therapist, and people are normally shocked to find that out, because I spend a lot of time talking about pelvic health related conditions, especially women with pelvic health conditions. And when it relates to PCOS, I see a lot of women with this diagnosis simply because they do have pelvic floor dysfunction. They're usually having, unfortunately, pain associated with menstruation. And also, obesity can be a huge concern for this population because you heard Dr. Sammy mention insulin resistance. And I want for us to kind of go into that a little bit more because when people hear insulin resistance, I don't really think they understand what that means. And we know that puts that when someone is insulin resistant, that means that they're at higher risk for diabetes. So, Dr. Sammy, can you tell us a little bit more about that and the impact that diabetes itself can have on the entire body? Because you did a great job mentioning that this is a metabolic condition. It's not just a gynecological condition. This is something that impacts the entire system.
Yeah, yeah. And I want to spend a little bit of time talking about system because, again, it's a whole body thing and it gets, mislabeled as a GYN concern when really that's just a symptom of the bigger picture. So, when it comes to insulin resistance, before I get into that, I just want to share a statistic. And I typically share this with a lot of my clients, and that is that women that are diagnosed with PCOS from the onset of their diagnosis, within 20 years of their diagnosis, approximately 50% of those patients end up developing type 2 diabetes. So that's one in two, half of women that are diagnosed with PCOS within 20 years, they have type 2 diabetes. And when we look at what is the thing that's holding that together, it's insulin resistance, right? So I mentioned earlier that insulin resistance accounts for 80% of about 80% of women that have PCOS. And what insulin resistance is specifically, it's when your body is exposed to too much insulin. So our bodies naturally release insulin whenever we are exposed to sugars, carbs, things of that nature. And the sugar ultimately has to get into our cells. It's supposed to create energy for us to do our day-to-day functions. Now, the issue with that is that when there's too much insulin, the receptors or the thing that insulin binds to, it stops working. And we have insulin receptors on our ovaries. And the issue with that is that whenever insulin is in excess, it starts a pathway that pretty much creates more testosterone that flows from the ovaries. And that is why we see symptoms like hirsutism or excess hair. We see cystic acne, especially along the jawline, because we have a lot of testosterone or male hormone receptors along your jawline. So, we see a whole bunch of other things due to the insulin resistance. Um, a lot of times women, they'll find that they have a dark patch along the back of their neck or in their armpits. And again, that's due to insulin resistance, right? As well as fat that accumulates within the midsection. And we know that the research shows that fat in itself, it acts as an organ because it secretes inflammatory markers. It secretes a whole bunch of different things. And a lot of times that fuels the cascade of inflammation, which is like the step under insulin resistance that's really triggering the PCOS. So,
So I
um,
want to pause you really quickly because you mentioned something that is also key. So first you mentioned insulin resistance, and then you also mentioned testosterone, because people don't realize, but this is a characteristic that is usually associated with diagnosing PCOS, and that's elevated androgen levels, especially testosterone. So before you go into explaining more, do you mind letting everyone know how do we typically diagnose this? Because this is a syndrome, and we know that young girls can be diagnosed with it even without having all of the symptoms. We also know that generally speaking, there are like a collection of symptoms that people have to have in order to get the diagnosis of PCOS. Can you tell us a little bit about that so we can jump back into explaining how this impacts the body?
Yeah, absolutely. So, diagnosis wise, medical professionals, they use the Rotterdam criteria, which funny enough, you do not need polycystic or cysts on the ovaries to
Thank you
be
so much for saying
diagnosed
that.
as PCOS. So, PCOS, you only need two of the following three. So, one is an excess of male hormones or androgens, either on the labs or physical symptoms. So, like we discussed earlier, the hirsutism, the cystic acne along the jawline, male pattern baldness.
Yes.
Those are all considered symptoms of excess testosterone. So that's one of them. The other one is anovulation or not being able to ovulate, not having regular cycles, anything that has to do with your body not properly ovulating on a regular, on a quote unquote regular schedule. So like 27 to 30 days usually is considered regular. So that's the second thing. And the third, if meaning you only need to have two of them, the third is polycystic ovaries. So what happens is that insulin that is responding to the receptors on the ovary, they get stimulated and they form these tiny follicles. So not one or two, you need to have like a bunch to be considered polycystic. And typically we can see that on an ultrasound. It's called a string of pearls because it literally resembles a string of pearls, just like tiny follicles. So any two of those classifies you as PCOS.
Awesome. No, thank you so much for that explanation because people tell me, "Oh, I have PCOS." And I'm like, "Okay, so let's talk about some of the symptoms that typically go along with it." And they don't meet the criteria. And at that point, we have to figure out, okay, so why isn't your cycle coming normally? Because you did mention that it's an irregular cycle. And if you're not having the other symptoms that are mentioned, then you like more than likely do not have PCOS. So it is important that you actually sit down with your medical provider, with your health coach, someone with the expertise such as Dr. Sammy. That way you can make sure that you are addressing your needs properly. Because having an irregular cycle due to, let's say, nutritional deficits is going to be different compared to treating someone who has the irregular cycle due to PCOS. So no, thank you so much for that. And thank you for also mentioning the symptoms that typically go along with it, as far as like the male pattern baldness, that skin changes that occur. Because I know some people can sometimes have skin tags as well. They can have skin
Yes.
discoloration and darkening, the acne, the hair loss, and then also the excessive hair growth along the jaw lines, and even sometimes on the arms and on the legs.
Yeah.
And it's just something that, this is a conversation we need to have more frequently because unfortunately, this is something that growing up I didn't know about. And then, in all honesty, until I got into women's health, I had no idea about this diagnosis. And with irregular cycles, let's be honest, unfortunately a lot of these young women, they're experiencing pain with it as well, and we know that that can be attributed to some of the lifestyle things that you mentioned, so we'll jump into that in a bit. But I also want to make sure that before we jump into some of the lifestyle holistic things, that if you're not having a regular cycle, please talk with your medical provider. That can range anywhere from like 21 to like 35 days, depending. The whole 28-day thing is more of a myth. It's not, most people are not going to be 28 days exactly. And it's okay to have some ebb and flow where you may have one month where you're at, 27, the next month you're at 30 days. That's still within a normal range. But if you are going several months without your cycle, if you're not having at least 4 cycles a year, that is a reason to be concerned. Even then, I'm gonna be honest, if you're skipping cycles and you're still having I still want to know. So make sure you're having these conversations because a lot of people think it's normal and it is not. So, Dr. Sammy, before we jump into the holistic approach, tell me more, just a brief overview as to when someone goes to see their medical provider and they have PCOS, what type of medical management options are they going to be given? Because you said at the end, you said before, at the end of their appointment, they're going to tell you, oh, and lifestyle management. And we'll jump into that, oh, and lifestyle management, because it can be very simple to make these adjustments, but people just don't know what adjustments to make. So before we talk about that, let's talk about the medical piece of it.
Yeah, that's a great question. So currently, the conventional medications that are offered to women with PCOS, number one is oral contraceptives, so like birth control. And what that does is it creates a quote unquote a fake period, because you're taking pills specifically that have hormones in them for about 3 weeks. And then on the fourth week, we call it withdrawal bleeding. So it's a cessation of that medication that
Say that part one more time for me, because people think it's a real bleed. So say that again for me.
yeah. It's called withdrawal bleeding.
Thank
And that is
you.
only due to you stopping taking the medications for that 1 week. It's not an actual period. And I think we definitely need to emphasize that. So that is one option. That is the oral contraceptive route. Typically, a lot of women with PCOS at some point in time, they will get put on metformin. Metformin is a glucophage, it is a diabetic medication. And the reason why metformin is prescribed to women with PCOS, again, OBGYN is because they know that PCOS is associated with insulin resistance. So that is why a lot of women are receiving metformin after they've received their PCOS diagnosis. In addition to that, they give medications for symptom management. So spironolactone is one to help with like the cystic acne in the hair, the excess hair. There's also medications that can be prescribed if you want to start ovulating. So specifically, your OBGYN may prescribe this. You may see a fertility specialist and they may put you on this. But those are the typical options that are there for women with PCOS.
Awesome. No, thank you so much for taking the time to explain that. Because it is important that, we consider the medical side of things. But I think sometimes the medical side is over addressed without the appropriate lifestyle management piece. And the medical management is important, but the lifestyle management is key. So this is where I really want to give Dr. Sammy the opportunity to elaborate, to talk to us about how can we manage PCOS symptoms with our lifestyle? Because we keep hearing lifestyle management and lifestyle medicine, and people really don't know what that means. And it is something so very simple, but it's also such a hard concept to break into because we're used to our habits. So, Dr. Sammy, let us know, like, what is this lifestyle management? What is this lifestyle medicine? And how is this extremely important for everyone, but especially when we're battling a chronic condition, because that's what PCOS is.
Yeah, that's a great question. So, before I dive in, I want to talk a little bit about what the four main pillars that is really driving PCOS. And it may not be in all women, but most women that have PCOS have a degree of some of these things. So, the first one is insulin resistance, which I think we spoke enough about. The second one is inflammation, which can be due to diet, it can be due to chemical exposure, the things that you're putting on your body that is causing inflammation on a cellular level. There's also oxidative stress, which is similar to inflammation, but that occurs more so on like a cellular level. And when I go through the ways that we can help fight that, we'll talk a little bit more about how we can address oxidative stress.
Awesome.
And the last one is gut dysbiosis. And this is more so recent in literature, but a lot of women with PCOS have some degree of a dysbiosis, meaning the bacteria in our gut is off. And that has to do with our diet. So when I was obtaining my doctorate degree, I did a lot of research on PCOS and dieting. And to date, one of the most effective forms of dieting is the Mediterranean diet.
Yes, it is.
Yes, and that diet is so beneficial because it is highly anti-inflammatory. And if you remember, one of the things that I spoke about was inflammation. So we combat that with anti-inflammatory foods. So the Mediterranean diet pretty much consists of whole fruits, vegetables, high fiber, healthy oils and fats. So like avocados, avocado oils, olives, olive oil, nuts, berries. Berries isn't an oil, but you get the point. Yeah, berries are also really high in fiber. So we want to be incorporating a lot of fiber into our diet, especially if you've been diagnosed with PCOS. So there is that dietary component.
And you said whole foods. So
Whole foods,
I
right?
think people need to understand that whole foods don't come in a package. Okay. That is something important to discuss. That whole foods don't come in a package. So if by chance, let's be honest, sometimes you have to grab and go, read the labels. If you can't pronounce it, don't eat it. And or at least minimize your exposure to those things because a lot of times those are preservatives and additives and even things with the who that are packaged they have higher levels of salt content and sugar content so that way they can help preserve the food. But you just heard Dr. Sammy say that a portion of managing PCOS is managing inflammation. So if you're eating all those things, and I know she's going to go into much more detail with as she explains, but if you're eating, processed foods, then you're going to expose your body to more stress, more inflammation. So, Dr. Sammy, yes, thank you for that because whole foods are important. I'm happy you said that word, whole foods. That is so
Yeah,
important.
absolutely. And I definitely agree. If you can't read it, don't eat it. There's so many different additives, especially in the American diet. Um, that we don't realize is like actually causing that inflammation on a cellular level. So we really want to be watching what we're eating, especially in that area. So we discussed diet, right? Exercise, getting some form of movement, because exercise, it produces a substance called the nitric oxide. And nitric oxide is so important because that's what helps open up those blood vessels, and allows for nutrients to actually flow throughout our body. I can talk days about nitric oxide, but we don't have the time, unfortunately. But if you can, definitely look up nitric oxide and things that help increase it. So, eating whole foods increases nitric oxide, exercising, doing cardio, these are all things that increase nitric oxide, which ultimately is going to bring down that inflammation in your body. So, think about nitric oxide and we talked about exercise. I guess we'll talk a little bit about oxidative stress, because in order to combat oxidative stress, we need to incorporate antioxidants into our diet. So antioxidants, think of colorful foods, right? There are so many different antioxidants that we can discuss that have been shown to specifically help women that their PCOS is being fueled by oxidative stress. And it can also help reverse the oxidative stress. In addition to that, gut dysbiosis, we can tackle that with probiotics, prebiotics, and symbiotics, and really trying to balance the gut and the microbiome.
So this question comes up a lot, and because you mentioned it, I'm going to ask you so that way you can tell people, because I have to have this conversation. Probiotics and prebiotics. How do I know if it's a good one? Because sometimes I'm looking at the labels of what people are showing me, and I'm like, this doesn't have enough of what you need in it. So how can someone know if they have a good one?
Yeah, that is a really good question. I mean, it varies. I have a few. If you guys want to stick around to the end, I can definitely give some suggestions. I would definitely read the reviews. Generally speaking, you definitely want something that has a minimum of 500. I'm sorry, not 500, 50 to 60 CUs. So that is definitely going to be considered average for the probiotics that you should be consuming. And it's so important to have probiotics in our diet, because that is really what's going to help fuel those. We have receptors in our gut that translate to our brain. And when we're giving our gut the proper things that it needs, it's also going to signal that to our brain. So, a lot of women with PCOS deal with anxiety and depression. And when we correct things that's going on in the gut, you often see that that symptom in itself tends to be alleviated. So we went a little off topic there, but I hope that answers your
No,
question.
that's important. No, that's important. I'm happy that you brought up the relationship between the gut biome and the brain, because it's oftentimes we forget about that. So that's not off topic at all. That's perfect, because it is a very common symptom for women with PCOS to have the mental health concerns. And we want to make sure that we're doing everything that we can to address those things, including, making the lifestyle modifications that you mentioned with our diet as well. And just to add this in, because I am a physical therapist, you already mentioned the importance of exercise. Exercise as well can also be extremely beneficial for mental health and depression when it comes to depression and anxiety, simply because of release of endorphins and also other chemical changes that occur within the brain. Also, with exercise, I know Dr. Sammy mentioned the importance of like cardiovascular exercise, which is a huge key. Don't forget resistance training, because resistance training, especially with insulin resistance, can be very important with helping you to better manage your blood sugar levels. And then also, like I said, I'm a physical therapist. I have to throw it out there. Long term, we are going to get older, y'all. So it can be really helpful for us maintaining our bone mass, and also our bone density and our muscle mass, which can help combat the adipose tissue, so that fat tissue around the tummy that Dr. Sammy mentioned, which we know is associated with insulin resistance. So I just had to throw that in there because, like I said, with me being a physical therapist, it's important that we know all of the benefits, and the benefits of exercise, the benefits of importance of changing our diet. And you mentioned as well before, something at the very beginning. So far we talked about exercise, we talked about dietary changes so that we can impact gut health, also impact inflammation. Talk to me more about stress. Because people come to me, and a lot of times Some of their pain is related to stress. So can you tell me more about what can we do and how does stress impact our pain? Can it impact our pain and our symptoms with inflammation with PCOS? Is that something that can happen?
Oh yeah, definitely. So I'm gonna talk just really briefly about insulin because we really see insulin as like the master hormone, meaning that if insulin is off, most likely your other hormones will be off as well. And one of those
Mhm.
other hormones is our stress hormone, which is known as cortisol.
Yes.
And cortisol, a lot of times we see that to be elevated in women with PCOS,
Mhm.
and that only fuels the cascade. So it's really important that we are dealing with our stress and having healthy coping mechanisms. So you can do that in a variety of ways. One of my favorite ways to cope with stress is really journaling, therapy. And like I said in the beginning, I'm a Christian, so I definitely believe in the power of prayer, especially in stressful moments. So I'm just going to say that
Mhm.
um, I think it's really important that we try to minimize stress as much as possible. Sometimes we can't, sometimes things are out of our control. But it's really important to identify what those behaviors are that are resulting from our stressful situations. Because if we're able to combat the initial thoughts that come, we call those negative thoughts, we can definitely see a difference in how our body copes with the stress and how we handle it. I also believe that there are different things that can help supplement wise to help deal with stress. One of my favorites is honestly magnesium, especially in times of stress. You know, magnesium is definitely helpful.
And magnesium itself, if those who've drunk before, they know I do have a slight fascination with good bowel movements and poop.
Hmm.
So magnesium, certain types of magnesium can also assist with that and prevent constipation.
Yeah.
And if you also have a good diet and good gut health, that also can help prevent constipation, allow for better bowel movements because a common symptom with PCOS is constipation, which guess what? Makes your menstrual cramps worse. So you have to make sure that, we're taking care of that piece as well. And that's just that is off topic, but that is an important thing that we
No,
need to
I
manage as
appreciate
well.
it. Yeah, we need to know that.
Yeah, that is off topic, but yeah, a good bowel movement. You should have a bowel movement every day, y'all. Every day, okay? If not, let's talk about why you're not. And now back to the dietary component and the lifestyle component, because I was talking with a dietitian before, and she mentioned we should try to have like 30 different types of fruits and vegetables within a week. And my jaw dropped. I was like, am I getting that? And then she made me feel a little bit better because she said that if I eat bell peppers, the different colors do count. And she brought up a great point. We should really try to eat like a rainbow every day. And
Yes.
and I was like, that is a wonderful way, an easy cue to give your patients, check off the things that you've had in this rainbow. And I'm not talking about orange equals hot Cheetos, orange equals carrots, orange equals, orange bell pepper, or even orange tomatoes. So you're trying to eat, like Dr. Sammy said, the whole food component. And she mentioned the rainbow piece. I know because you had mentioned the importance with diversity of the diet. I just wanted to give that little helpful tip because sometimes the helpful tips can be a little bit easier as you're looking to try to make the lifestyle changes.
Yeah,
So we've talked about
absolutely.
that. We've talked about some of the stress pieces. And there's one thing that goes along stress that we did not talk on. And this is also something very important. I know I can do better in this aspect of my life. And that is sleep. Dr.
Yeah.
Sammy, tell me, how does sleep impact my health? Even, I know it can impact my mental health. People have told me that, but how does it impact my overall health? Especially, you mentioned a lovely hormone, cortisol. What happens if I'm not getting enough sleep like the average American isn't?
Yeah, I love that you brought that up because there's so much intertwining with cortisol and how it relates with like our sleep and just everything. And sleep is very important, right? We should strive to have 7 to 9 hours of sleep every night or day if you work nights for whatever reason. But the reason is because when our circadian rhythm, meaning our sleep and wake cycles, are off, everything else is just going to be chaotic, right? I remember reading a study, and it said that there were two groups of people. One group had adequate sleep and the others didn't. And it's something as simple as their food choices, right? Think about it. Have you ever been tired and you didn't feel like cooking a healthy meal, or you grabbed a bag of chips just because it was convenient and you didn't have the energy to really sit there and make a meal? Like, that is a real thing. I know for me, when I'm tired, I'm just trying to put something in my mouth and go to bed. Um,
Yes.
but specifically, with when it pertains to PCOS, it was actually found that a lot of women with PCOS, they are deficient in melatonin, and melatonin is the hormone that's responsible for our sleeping. So cortisol is meant to rise specifically in the morning, and usually it peaks off like around like noonish. But melatonin is what really is supposed to be sustained throughout the night to help us have good rest. And a lot of times women with PCOS are deficient in melatonin. Now, I'm not telling everybody to go and pick up a bottle of melatonin. There are very simple things that we can do to
Mhm.
incorporate melatonin naturally. You can set a screen time limit and actually like listen to it. Like, no phones 2 hours before bed. Stop whatever you're doing, chores, cooking, cleaning, and give yourself 2 hours of just free brain time without being in front of a computer, and your body will naturally start to produce melatonin adequately. So a lot of the times it has to do with our current lifestyle. I really like the book Atomic Habits by James Clear. um,
Yes.
and for any of you who've read or haven't read Atomic Habits, the whole concept is that it's the little things that you do that really make the difference in the end. So it's like, think of like an exponential graph, right? You start off by putting your phone down at night, and then it leads into you having a nighttime routine. You set the atmosphere. These are all things that are going to help you get better rest and ultimately help with those PCOS symptoms, ultimately, because we need sleep. At the end of the day, we need sleep.
Yeah, and I love that you said bedtime routine because let's be honest, when we were growing up, we all had a bedtime routine. If
Right.
you're a parent, you give your kids a bedtime routine. But then something happens when we become adults and we forget a bedtime routine. And I love that you mentioned it. I love that you gave basic tips when it comes to sleep hygiene, like, hey, turn off the phone a certain amount of time. And then also make sure you give your body a chance to kind of unwind. And I know, I actually have had patients before where they tell me, I have to write down my thoughts. Otherwise, I'll keep thinking them as I'm trying to go to sleep. And if you're someone like that, yeah, find a way so that way you can kind of start turning your brain off. And this other simple tip, take the TV out of your room, out of
Yeah.
your bedroom, because you're probably, especially if you're falling asleep with the TV on, you're not getting good quality sleep. And Dr. Sammy mentioned that, getting 7 to 9 hours of sleep is important, which it is. So is the quality of your sleep, because if you're not entering into deep sleep during that 7 to 9 hours, you're going to wake up and feel exhausted. So you have to make sure you're taking those basic tips. And also, if you're someone who has to wake up several times a night to urinate, we need to figure out why. And if it's because you're drinking too many liquids too late in the day, we need to flip flop that and drink more frequently in the morning to the afternoon. And then that 2 hour mark tends to be key for a lot of people. 2 hours before bedtime, avoiding drinking liquids then if you're waking up throughout the night to have to use the bathroom, because that disturbs your sleep pattern. And that's something we don't want to happen, especially if we can prevent it simply by just making sure you're able to stay asleep and, go the full 8 hours, 7 and 9 hours without having to wake up from that disturbance. Awesome.
You bring up a really good point. Yeah.
And Dr. Sammy, I know because we started late, I know we are probably pressed for time, and I just want to make sure because you mentioned in the beginning like certain supplements, and as we start talking more about supplements, you also heard Dr. Sammy mention with the prebiotics and the probiotics. So with this, we are both medical providers, we're both healthcare providers. We are not your healthcare provider, okay? So before you add anything into your routine, make sure you speak with your own providers, because even though these supplements can be purchased over the counter, meaning you don't need a prescription for them, there are times where supplements can interact with other things that you are taking. And what we don't want is we don't want you to have an adverse response. We want to make sure that you're taking care of yourself and that we also acknowledge that you are an individual. So with that being said, Dr. Sammy, tell me, what are some recommendations you have for supplements? Because there are a lot of things I know that people try to use to support menstrual health, try to use to help support inflammation. What do you typically recommend people ask more questions about and explore with their health coach, their healthcare providers when they're having these conversations?
Yeah, yeah, definitely. And emphasis on speak to your medical provider first. I think that with PCOS, we really, before we start talking about supplements, we need to address any nutritional deficiencies. So,
Agreed.
regardless of if you have PCOS or not, I wholeheartedly believe everybody should be on a multivitamin because a lot of times our PCOS can be fueled with lack of vitamin B. Vitamin B deficiency is super common with women with PCOS.
Mhm.
Low vitamin D is a big
Yes,
one. 80% of women with PCOS are deficient in vitamin D. So, sunlight, salmon, take a supplement. Definitely, if you're low in your vitamin D, start taking it. Start taking it. Vitamin D has even shown to improve symptoms of depression and anxiety.
yes, it
I
is.
did that in my research. So, yeah, we talked about B vitamins, vitamin D, vitamin C. So, like the main vitamins that, they tell us that we should be taking that's been ingrained in us since we were a kid, definitely. I also think that, I'm sorry, you were going to say something?
No, you mentioned salmon. I was just going to ask if you could tell us more about, the omegas.
Oh, yeah, that was the next thing I was going
Oh,
to talk
awesome.
about. So yes, omega 3s, very anti-inflammatory, has a lot of antioxidants in it. So remember we talked about that. Definitely I would incorporate fish oil if you can into your diet. Outside of like the main things that is like the foundation, having those filling in those nutritional gaps. If you're someone with PCOS and you're struggling with having a regular period, I think myo-inositol is very beneficial. Myo-inositol in a 40-to-1 ratio. So myo-inositol and D-chiro-inositol has been shown in the research to help with women that are having ovulatory dysfunctions and helping to sensitize insulin. So that's super important. I also believe that berberine is really helpful for women that have insulin resistance because it is a very potent insulin sensitizer, especially if you're someone who struggles with excess adipose tissue or fat in the midsection. Berberine has been shown in multiple studies to have very similar effects to metformin. So I would definitely, speak to your medical provider first and see if that's something that would be beneficial to you and your lifestyle.
You may not realize it, but she just gave you all a free coaching session. And I appreciate her time and her expertise because that she gave us a ton of information that I know, her own patients, her own clients truly appreciate. So please make sure, Dr. Sammy, let everyone know. You told them where they can find you on Instagram. Let them know your website. So that way they just know how to find you, how to locate you. They can follow you and they can get all of this information and truly utilize your expertise in your coaching.
Yeah, absolutely. So my Instagram is at Zaiteo Wellness. That's Zaiteo Wellness, Wellness. And my website is drsammywellness. So drsammywellness.com.
Awesome. And on YouTube, those links will be posted so that way you all can refer to the description and you'll be able to click those.